Now, with that said, it is truly my pleasure to introduce someone very special, someone that I actually know as well, who is a powerful and inspiring poet out of Cleveland. Her name is Liberty. She's showing on the screen as Lana Price. Her voice is so amazing, and it just comes with so much truth and healing, and hopefully through this poem transformation. I will let her take it from here.
Hello, everyone. And Tanika, thank you for that beautiful introduction. I am honored, excited to be here with all of you and just share a few words with you all. And I just thank you for listening and receiving. The big C, change. What we desire to inspire. Communicating for our community is a commonality where we gain the opportunity to tap collectively and cohesively into the cooperative of navigating to a channel, collaborating, beginning and bringing forth our consensus and concerns about what we see or don't see with changes in understanding centered around this challenging, life altering dis-ease for not just the individuals alone, but as well for their family and their friends. Here is where the intercession for those we love who've experienced complex, convoluted explanations begin. Women, connected for better health, carries the desire to spread a wealth of knowledge to the community, listening not only to comprehend, but to better understand the concerns silenced by their fears. We are here to empower women and their feminine energy through building a platform for healthy conversations and advocacy. Peace and blessings. Thank you all for having me.
Thank you. Thank you very much. That was so beautiful. Thank you.
Thank you. Love it. Thank you.
Thank you.
Thank you.
I think from here we're going to pass it to our moderator, Yvonne.
Good evening, everyone, and welcome to our Healthy Communities first Women's Connected for Better Health webinar, Cancer, Coverage, and Crisis, Navigating 2025. As a cancer patient in 2025, health policy isn't just politics, it's personal. With significant cuts to Medicaid and a rapidly evolving care landscape, understanding how these changes affect your access, treatment options, and financial security is critical. In this session, a provider, a policy expert, and a patient advocate will share their insights to help you make sense of what's happening in health policy, what you need to watch, and how to advocate for yourself and others during this pivotal time in cancer care. In this session, it will be recorded and snippets may be used for promotional purposes. However, we will not record the audience question and answers. I'm Yvonne Oliver, a cancer survivor 2 times and an advocate, a community based researcher and communications professional. I have the pleasure of introducing your panelists and moderating the conversation this evening. Deb Collyar is founder and president of Patient Advocates in Research and a cancer survivor. She's been a leader in patient engagement and advocacy since her first cancer diagnosis. She utilizes her business leadership, IT, and communication skills to bridge research gaps between scientists, medical providers, and patients. Stacy Mathews is a hematology and medical oncology nurse practitioner and cancer survivor. She has been a nurse practitioner for over 15 years. In 2023, she joined the Community Outreach and Patient Navigation Program, where she is dedicated to promoting community health literacy and raising awareness, as well as encouraging registration for overdue screenings. Dr. Lindsay Sabik is a professor and vice chair for research in the Department of Health Policy and Management, a member of the University of Pittsburgh's Medical Center, Hillman Cancer Center, and the director of Work Group on Cancer Health Research within the Health Policy Institute at the University of Pittsburgh. Dr. Sabik is a health economist and health services researcher focused on investigating how state and federal policies affect healthcare access, utilization, and health outcomes among low income populations with a particular focus on cancer care. Now, without further ado, let's start the conversation. And Deb, we'll start with you. What was one of the most surprising and challenging obstacles you had to overcome during your cancer journeys? You're
Thank you, Yvonne. I, yeah, I'm trying to use the mute button. Um, okay, so my two cancers were actually both breast cancers. One was triple negative, one was stage one, ER positive. And, in the 90s, there were differences. So the good news is there have been some improvements in treatments and options for people, but unfortunately, a lot of it is still the same. It's still as confusing and complicated as it can be. And so I try to focus on issues that people are facing today rather than what I did before I had any of this white hair. And how can we continue to make the healthcare system and um, research where new advances come from better for patients and focus on them. So Pear's tagline is where research meets reality, and that's what we try to bring to research and healthcare every day.
That's great. Thank you. Stacy, we learned a little bit about obstacles from the patient advocacy perspective with Deb. Now, from a provider perspective, what are the biggest barriers your patients face when accessing timely cancer care?
Thank you for that question. When I interact with patients and it comes time to accessing cancer care, some of the things that I encounter is patients may actually have trouble getting to their appointment, lack of transportation, due to their possible demographic location, not having, even Uber service or local just bus routes that can get them to their treatment. And, some of the other things that I face in terms of when it comes to barriers that prevent timely cancer care is lack of insurance, a financial component. That is a huge barrier in accessing care. And even those with insurance, just being able to afford their copay. Um, there may be copays to their actual medication treatment, certain medications that is prescribed along with their treatment in cancer care. And social determinants of health, is a barrier, again, due to some of the things that I mentioned earlier, their socioeconomic status, not having the social, support to, or network, I should say, to help them navigate and encounter with, their cancer care. Um, and I think, those are some of the reasons why patients may have trouble accessing timely cancer care.
Excuse me.
Yvonne, while you're finding your notes, there was one thing I was going to mention, and I'll probably bring it up again. Um, as far as cancer care today, one of the big issues is biomarker testing. And a lot of people don't have access, as Stacy said, may not have access to insurance or be underinsured, but a lot of cancer treatments today are focused on what biomarkers you may have that your cancer is using against you. And there are treatments that sometimes are available. And if people don't get biomarker testing, they'll never know that.
Thanks for that, Deb. Dr. Sabik, there are times with factors that are outside of our control directly impact whether we can access cancer care or not. referencing the budget blueprint, the U.S. House of Representatives, that directs $880 billion in Medicaid cuts over the next decade. What are the potential consequences of those cuts to cancer patients who have Medicaid?
Thanks, Yvonne. I think to answer that question, I want to briefly just talk about some basics of Medicaid, because much of the debate is focused on adults in Medicaid who were newly covered under the Affordable Care Act over the last decade or so. But the Affordable Care Act did expand the role of Medicaid, and now nationally, Medicaid covers about 1 in 5 people, and that includes a lot of different populations. So it's almost 40% of kids are covered by Medicaid, but also 1 in 6 adults and almost half of adults who live below the poverty line. And more than 1 in 4 non-elderly adults with disabilities are covered by Medicaid. So it's a really important program that covers a wide range of people as their main source of coverage, and then also supplies supplemental coverage for Medicare enrollees. So it covers those high out-of-pocket costs for a lot of Medicare enrollees with low incomes. So that's sort of Medicaid overall. It also, because it's such a big part of the healthcare system, it pays for about a fifth of healthcare spending nationally. So when it comes to Medicaid and cancer, the American Cancer Society estimates that 1 out of 10 people with a history of cancer and 1 in 3 kids diagnosed with cancer rely on Medicaid for coverage. And over the last decade, my colleagues and I have done a lot of research about what happens when states expand Medicaid, and one study about Tennessee when they contracted Medicaid. And we really consistently find that when states expand their Medicaid programs, there are increases in cancer screenings, there are increases in early stage diagnosis, and there are increases in insurance coverage among people who are newly diagnosed with cancer.
The meeting, Gabe.
So I think consistently, we see that Medicaid does matter for getting people cancer screenings that are recommended, finding cancer earlier, and then connecting them with treatment. I also will mention that Medicaid plays an important role for breast and cervical cancer patients through the Breast and Cervical Cancer Treatment Program. So there are really important implications if Medicaid is substantially cut for preventing cancer, detecting cancer early, and getting people treatment that they need and they can afford without having them go bankrupt. And then I'll just note that beyond just individual patients, because Medicaid pays for 1/5 of the healthcare expenses in the country, it's really important for providers. So there have been a number of reports recently that hospitals, particularly in rural areas, community health centers that really rely on Medicaid funding, are very worried about potential cuts, because if more of their patients are uninsured, they often already have really thin margins. So if they have to cut back substantially or close, then that affects all patients in those areas or who rely on those providers, not just the patients with Medicaid.
Thank you. Deb, if we wanted to ground what Dr. Sabik shared regarding potential coverage changes, what should the public and policymakers understand about cancer care that they often overlook? You're muted.
Gosh, I was starting to say brilliant things too. Okay. I think one of the things that is really important for everyone to understand, whether they're in the healthcare system or they're policymakers as we go along, is that people are the same people they were before they became a cancer patient and get relabeled, and everybody treats them differently. I do have a couple slides that I'd like to share because I'm a visual person, and so it may help. I will take them down again quickly here, but I wanted to make sure that I have that available. And I think I'm just going to show them this way rather than as a slide projection. But this is actually something that I use a lot in a lot of talks that I give to health systems, research communities, policymakers, is that, I really think that we have a U.S. sick care system, not a healthcare system. and it goes into action when something happens to somebody, but we don't always know that what the first diagnosis is the actual or last diagnosis. And so people who become patients feel the same way, but they also feel like they were just catapulted onto a new planet without any type of roadmap, dictionary, or survival training. So it's a very lonely place to be. And we need to do a lot better job of helping people understand what's happening, why it's happening, and what they can do about it, and what their healthcare team can do about it. And I also use this cartoon because I love this. Um, Trying to help explain to people that what's always missing for people and patients is context, right? So often we don't understand what what's happening, why it's happening, and then how they need to understand that. So the system, policymakers and healthcare systems and all of that are on the stakeholder side, right? And they've designed this system and they think it's wonderful, or this informed consent form, or whatever it is, procedures that this person can go through, and they think it's just great. But if you look at it from the user perspective, it can look very different, and it doesn't necessarily have the same meaning, connotation, and certainly not the same perspective. So, the baby sees a whole different picture than the parents in this cartoon. And we need to remember that. And so I think what we're trying to do, I'm going to blatantly bring up the Institute at One Cancer Place, because we are actually housed on our healthy community, thanks to Silas and the team. Um, and we're doing this as kind of a demonstration project, but also to help people understand. And it is for um, patients, caregivers, and who we're calling passionate allies, to help learn more, to help us turn a fragmented healthcare system into a landscape of survival, because that's a whole different way of thinking of it, and a whole different way that we approach care for people if we're focusing on a landscape of survival. Teaching cancer as a foreign language, because frankly, it has a lot of strange terms and things that people need to learn. And then, you know, nurturing patients who are becoming patient leaders, for instance, if they want to help other people, if they want to talk to policymakers to make things better for patients, if they want to work with researchers in either healthcare settings or other settings, clinical research and that type of thing. Um, there are ways to work with them where we can share our voices and our issues and really help make a difference in some of that. And I think I'll stop sharing there. Um, I hope that answers the question, but I think it's really important, and again, I'm going to emphasize the biomarker testing, because your first treatment that you get for your cancer can sometimes be the absolute most important treatment that you get. And if you don't know that some promising treatments are available to you because they attack things that your cancer is using in your body against you, then you may not have your best option first, and that may cause problems later. So, those kinds of things and second opinions are very important.
Thank you. Stacy, we've been focusing on policy, but what do you wish every patient, provider, and or caregiver um, knew about navigating cancer care?
Well, I'll start with, talking about patient and navigating cancer care. Some of the things that I wish a patient knew when navigating cancer care is it is okay to be your self advocate. And what I mean by that is if there is, just say you're going along with treatment, if you're not feeling well, or if you have a question about your treatment, to be that self advocate and ask, those questions or express a concern. I think sometimes when it when it's in that dynamic, the patient and the, provider, sometimes the patient may feel, a bit maybe intimidated or uncomfortable with being that self advocate because they're like, okay, the expert is in front of me. They're telling me all of this information. How dare do I question or ask a question? So being that self, advocate is really important. Um, Another, thing with patients in navigating cancer care, Deb had just mentioned this just a little bit, is it's okay to seek a second opinion. If there is a provider that you may not have completely understood or just say connected with or whatever the case may be, absolutely you can seek that second opinion and gain more information. From the family caregiver side, I encourage family, if available, caregivers, if available, to accompany patients to all of their appointments. Me being a patient as well as a provider, me being on that patient side when I was going through my chemotherapy treatment, I am well versed in, the oncology world, but it's very overwhelming when you're receiving so much information. And I think it's, encouraged again to have that caregiver along and not only have that caregiver along, but if your caregiver has questions, I would, encourage that as well. Um, Providers, we need to meet patients where they are. And what I mean by that is if you're in an appointment and a patient is having concerns or difficulties or things that they need to express and go through, be that listening ear as, a provider, be a support, and also have shared decision making between the patient and the provider. Those are some of the things that I wish everyone would know when it comes to navigating cancer care.
Thank you so much, Stacy. Dr. Sabik, what does the current landscape look like for scientific medical research?
Yeah, so I think at the current moment, in the US, in the last 4 months under the current administration, scientific research really is in crisis. So at the National Institutes of Health, the administration has canceled $2 billion in research grants, fired 1,300 employees, and they say they plan to slash 40% of the NIH budget going forward. And I think Deb, mentioned some of the advances in treatment over the last couple decades and the importance of biomarker testing and the continued, importance of research to understand how to improve treatment, improve longevity, minimize side effects. So much of this is funded by the federal government currently, and that really is in crisis. So I think if there are so many ongoing lawsuits and challenges to this, but there's already been a huge interruption to the current studies that are underway and planned research. And so if we continue to see studies, be ended, not receive funding, this is going to affect clinical trials, delay scientific advances, and really, you know, be an end to an era of scientific advancement and new treatments that has been this partnership with the federal government and research organizations nationally.
Thank you. Deb and Stacy, here's a joint question. Leveraging research to create and support evidence-based approaches to treatment is incredibly important for both patients and providers. The same can be said about policies like hospital systems policies. Are there current policies or proposals that you are particularly concerned or excited about?
I can go do, okay. So, one of the issues or policy changes that I'm very concerned with is a change that took effect or will be in effect at my institution where I work. And one of the policy changes um, is to collect co-payment prior to your office visit, or if there are any co-payments that are due for certain diagnostic tests, to have that collected at the time of the appointment. And if there is, if a patient is unable to pay, the appointment will be rescheduled. And I'm concerned because this can have a major impact in terms of what we're talking about today in cancer care, delay in timely diagnosis. There can be, a delay in a lot of different, diagnoses if a patient is not able to pay that co-payment. I know there were some exceptions with this new policy change that will take effect of June 1st. People who are in current like cancer treatment and things of that nature, this is kind of, they're not part of this change, but it does concern me, again, if someone is presenting for a possible consult to be worked up and things of that nature, not to have that co-payment, it's going to impact, a demographic that is having barriers to financial difficulty as it is. And now we're putting another barrier that, again, can prevent timely treatment and diagnosis.
Deb?
Yes, I totally agree with what Stacy said. And, the costs of cancer care, actually most medical care, but especially cancer care, are just ridiculous. Um, and the newer therapies are sometimes very promising and are helping where people live longer. And some are even helping people live better, but they cost so darn much. And so there are, things that can be done, but to have to face, being diligent and learning all of these things at one of the most stressful times in your life is not easy. And that's why a lot of times caregivers and family and friends and others will try to chip in to find out what can be done. There are some resources that I'll put in the group chat. Triagecancer.org is a great resource. It really kind of goes through some basics as far as what kinds of things you're going to face and expect financially and legally. And then they have workshops, even free workshops for people on how to work through some of these things. But, copays sound simple, especially to policymakers who don't have to pay them, but they can be really high depending on the insurance or lack of insurance that you have. So, those are things I'm concerned about. Each health system also works differently. So it's not like in the US we have one universal health care and it works the same way for everybody. And so that's a real problem, I think, for healthcare providers to try to figure that out. And I know in a lot of offices, they have at least one person just dedicated to financial issues and trying to work through the system. And I think someone here, I'm sorry, I don't remember who, said, I'm a patient navigator at one of the facilities, and that is so important to have someone. But we also need to make sure that the patient navigators are are helping the patients, not just being an employee of that health system, because you know we know health systems aren't set up for patients. Doctors and nurses tell me it's not set up for them either. So I'm not sure who it's set up for, except for the billing departments, right? So we've got to figure out how to change that. And I think one way that we have to do that is through teaching people how to advocate for themselves from the very beginning. And that's one of the things we're trying to do in the Institute.
Thank you. Well, this next question is one that all of you will have a chance to respond to. And that is, some states have or are considering work requirements for Medicaid eligibility. Although exemptions exist for individuals with serious health conditions, there is an administrative burden to prove an exemption that can be especially challenging for cancer patients, leading to loss of coverage. Dr. Sabik, specifically for you, what recommendations do you have for cancer patients with Medicaid who will be navigating a potential or actual work requirement exemption process?
Yeah, so this is so timely because the bill that's currently being, worked out, considered by the House of Representatives, they've made work requirements one of the main pieces of the Medicaid reforms they're proposing. And I think it's important to really call out that work requirements have been talked about for a long time, but they've only been implemented so far in two states, in Georgia and in Arkansas. Those are the only states where they've ever been implemented, and in both states they've been seriously damaging without achieving any of the goals that lawmakers say they will. So almost everyone who has Medicaid, who's under age 65 and not receiving Social Security disability, so those adults who receive Medicaid who are working age, most of over 90% either already work, are a student, are a caregiver, or are not able to work due to illness. So in some ways, this is a solution in terms of a problem that doesn't exist. Most people on Medicaid who can work already are, or have a reason that they aren't able to. And then these work requirements require validation or verification of the reason of work status, or the reason that a person can't work. And so it just adds a huge administrative burden. So, it's thinking about what Deb and Stacy have been talking about all the complexities of navigating cancer treatment, a diagnosis, all the questions. You're just adding another huge burden onto patients and their families to verify that they do already meet the requirements and they should be eligible for this coverage. So what happened in Arkansas was that there were widespread losses of Medicaid coverage. A lot of people were kicked off, and no employment gains. So these policies aren't getting people to work more. They really, the only way work requirements save money in Medicaid is by reducing the number of people who have Medicaid. So that, before this policy goes into place, I think it's important for people to speak up, to call out this sort of false narrative. And my concern is there's been a lot of talk about waste and abuse in Medicaid. And I think that those terms are being used to advance policies that really are helping people who need coverage, who are working or in school or caregiving, and they're, if they are advanced, they're just going to lead to huge losses of insurance. So I think the first step is speaking up against this, calling your representatives, your Congress people, your senators, and saying that this policy is not going to help patients. It's going to lead to more uninsurance and more administrative burden. So I think that's the first piece of it. But if work requirements do go into place, which I very much do not think they should, then I think for patients, it's going to be like so many other aspects of navigating the healthcare system, a matter of trying to be as informed, find the resources, and hopefully a lot of these types of resources that Deb has been mentioning will be on top of things like exemptions from work requirements to help patients have the information they need, know how to navigate the systems, know how to advocate for themselves on that insurance side. Though I just want to acknowledge that it makes no sense. People who are already trying to navigate a complicated cancer diagnosis and treatment plan should not be burdened with having to navigate a complicated insurance system that adds unnecessary administrative burden.
Thank you. I want to mention that Deb has put a couple of resources in the chat. And I have a question in the chat. Are social referrals like Unite Us and find help effective. And that's for all three of our panelists. Are social referrals like Unite Us and Find Help effective? So everybody's mic is on mute. Okay.
Yes. Okay. I'm off mute now. I think that they are effective.
Go
Um,
ahead.
Nobody has all of the answers, right? And can help everybody, unfortunately. And so there are still people who fall through the cracks, but um, there are social referral networks and organizations and funds sometimes uh, by state that can be important. The thing also is sometimes if there is a treatment that a patient can't pay for, sometimes the companies who make that drug will uh, will be able to help. Sometimes they won't, but sometimes they will. They have programs for that, which, don't get me started on those programs because they're good tax reasons why they have those programs. And if they actually charged less for their medicines in the first place, we wouldn't be in this situation for so many people. But at least there is something there that can help. Um, some people have set up also, GoFundMe accounts and other things like that to try to get treatment pay costs covered. It's not always just the drug either. Sometimes it's the hospital bills, which are really very difficult to understand if at all possible. I'm about to put another resource in here for the biomarker testing that I mentioned. Biomarker testing is not cheap. And so that can be an issue, but there are also workarounds for that in some cases. And so those are the kinds of things we're trying to bring to light. And when you shine a light on things sometimes and start pushing the issues, then at least people have to answer for them. If we and at best we've been able to actually change things and improve things for patients. It just takes so darn long.
So I'm just wondering, has anyone specifically used Unite Us and Find Help as a resource on our panel? Okay, well, Deb, let's go to what's your approach to helping cancer patients use their voice in complex care systems?
Okay. To use their voice, we've all kind of talked about, and I really appreciate Stacy and Lindsay's comments as well. I think first of all, patients need to know they have a voice, right? And we need to teach them how to use that voice effectively for their own care, their own situation. If they're a caregiver, that that's an important voice that needs to be spoken as well. And so what we're trying to do in the Institute, for example, is everything that we start with, and we have one learning session right now because we just launched this month in May. But everything that we do focuses on helping people learn to find their voice and to become their own self-advocate. Um, and and that's really important, whether they are helping a loved one or a friend, or if it's happening to them. So, how do you teach that? Well, you tell people some of the things we've said today. It's okay to ask questions until you understand the answers. It's okay to get second opinions. How do you do that? We're starting to try to put together information that helps people learn how to do those kinds of things and take action for their own health.
Thank you. Stacy, we've learned how important patient self-advocacy is from Deb and what her and her organization are doing to support patients with using their voices. Can you share the role that nurses play in helping patients navigate a cancer diagnosis?
You know, prior to me becoming an oncology nurse practitioner, I was actually a nurse that administered the chemotherapy treatments and taking taking care of patients who were actively going through treatment. And nurses play a really important role. Um, Nurses spend, and I want to make sure I say this correct, not saying that providers do not, but nurses are at that front line where they are taking a bit more time to hear the patient concerns, whether it may be a financial concern, or it may be a concern with even tolerating their chemotherapy treatment. And sometimes those concerns are not expressed when the patient is in front of that provider. Again, feeling a bit, I don't want to say, sometimes just uncomfortable, or maybe being intimidated with sharing those particular type of concerns. So nurses are definitely patients advocate. There were many times where I had expressed to the oncologist if a patient had concerns with maybe the treatment side effect, not understanding even the treatment regimen, and making sure that, at that next appointment, or even if the, treating or if the oncologist had time to come into the treatment room to come over and speak to, the patients about whatever concern they had. So oftentimes nurses are put in positions where they are the patient advocate, taking time to really go through the treatment, discussing side effects and things of that nature, and even making that really important connection with a social worker or a financial counselor if there is a continued financial burden. Again, patients having issues or troubles or struggles with affording their medications that may manage side effects, or if they have an issue again with transportation. So again, making sure, nurses make sure that they are connecting um, the necessary team to address those, concerns that patients express.
Thank you, Stacy. You got lots of compliments in the chat. Nurses are the best. They also help more than social drivers, help more with social drivers of health than many other providers. And another comment, the nurses are angels. Every cancer patient will back me on that statement. So our final question, and then I'm going to open it for Q&A, is for everyone. How can cancer patients, survivors, and caregivers engage in advocacy efforts to ensure continued access to comprehensive care? So that's the final question for our panelists.
Yeah, and I will start by just building on, my earlier comments about this being such a critical moment, because literally as we're talking, the House of Representatives is working to try and pass a bill that would substantially cut health insurance. And it's still to be determined what that will look like and then what will go to the Senate. But I think it's time for everyone who cares about access to healthcare and who has stories and experience to share, for patients, for healthcare providers to share their stories, with our lawmakers, but also with our communities, with our neighbors, to drive home the importance of having health insurance coverage available, and having it meet the needs of patients. And so I think the more people can make that case and speak up at these critical times, hopefully we won't see these huge cuts that some are trying to implement.
Okay, any other final comments before we open up to Q&A?
I would just say there are groups that are starting to resist the um, ridiculous policies that are being put forth, many of which may not be lawful. And of course, I think we need to support the judges who are, trying to stand up to this. There are also a lot of protests that are going on that can be helpful, but learning how to talk to policymakers, making sure your representatives know how you feel about what's happening and how this is hurting people. Those people are voters, or they're, married to voters, or they're kids of voters, or, whoever it is. We need to make these things uh, known. And there are groups like there's one called Indivisible. There are others that have actually started to um, organize protests all across the country on certain days. And I know one of the next big days for a protest is June 14th, which is called No King's Day, because it is also Donald Trump's birthday.
Okay. Thank you so much. Now we're going to turn it over for audience question and answers. Would anyone like to come off mute to ask their questions, or please feel free to put your questions in the chat. Do we have other comments, questions?
Yvonne, I'm gonna chime in after everyone else is done.
Okay.
I was just going to add on the not specific to the Cleveland Clinic copay piece, but I know in talking about the current bill that's being developed in the House of Representatives, I talked a lot about work requirements, but another piece of that, that's just come out in the past week is that they want to require co-payments for all adults in Medicaid who are above the poverty line. And when you think about the, poverty line for a single person is around 15,000 a year, the costs of cancer treatment and the co-payments that could be associated with that. I think it's another piece for people to speak up about, that implementing co-payments in Medicaid, which typically has pretty low or no co-payments for good reason to make sure people can access care, would be just another way they would be chipping away at access.
Other comments, questions? Tanika,
Okay.
we'll turn it over to you.
Okay. First, I just want to say that this was such an awesome conversation, great insight, a lot of information, a lot of helpful information. And we want you to know that we don't want this conversation to stop. And in fact, we're going to have so many more conversations like this, but it's going to be surrounding other ailments that we suffer from as well, especially maternal mortality or infant mortality or things such as, and I'm sorry, and other elements such as that. So I just want to take a minute to share my screen because I want to show you how to keep this particular conversation going, and where you can upload articles that may help others, as well as resources or tools. And you'll also be able to go back to this space to obtain or access some of the information that Deb was sharing with you earlier as well. So I'm just going to take a minute to share my screen. Can you all see my screen?
No, not yet. It just says you're starting to share it.
How about now?
Okay.
No, yes.
You can see it? Okay.
Yes.
All right. So most of you should be familiar with this space here because you are a part of this group now. I want you to take a look at the conversations piece, and you'll see that this is where all of the conversations that we're having will live. And so whether it's about the cancer for crisis topic, we're going to have a maternal health piece coming up. Of course, we have our book club coming up June 8th. If you don't know, we're going to have the actual author host, Andrea Colliar, who wrote the Black Woman's Guide to Black Men's Health. So she's going to actually host the book club on June 8th. So we hope that you all can tune in for that. But going back to this conversation here, you're going to see so many different topics, and this will be the first one. So once the meeting is over, we would love to get your feedback. If there's links that you want to share, if there's information, articles, forms, brochures, events, health fairs, whatever it is you think would be helpful for the community, we encourage you to share it in this space. So you would just, again, go over to conversations here. You'll see where conversations that count. This gives you a brief overview of it. We want you to keep the conversation going. So we want you to fuel this piece here. And you'll see that the forum for this month through June is the cancer for crisis conversation. So we just want you to go here You'll be able to see feature comments going forward, but to get started, you would click on the link here. And then it's going to take you to the actual space where you would be able to continue to have this conversation, ask questions, share information. And then I think there was someone mentioned sample letters. We encourage you to also pop the letters into that space as well.
Thank you, Tanika. Well, thank you, Stacy, Deb, and Dr. Sabik for your time and insights. This conversation is always timely. And before I go on, I want to say that Deb has said that if there are questions about cancer diagnosis at the Institute, she's happy to share that link and booklet for people who are interested, but she'll do it after next week when she comes back from her trip. So, but go on and look at hers. So, this conversation is always timely, and we look forward to hosting future conversations to help our communities navigate preventative measures. Future conversations to help our communities navigate preventative measures, a cancer diagnosis, and treatments. On another note, we hope that you'll join us next month as we launch OHC's first book club, Between the Lines, sharing with a conversation that will feature award-winning author Andrea King Colliar. On Sunday, June 8th, we'll talk with Andrea about her book, The Black Woman's Guide to Black Men's Health, from 6 to 7 p.m. on the OHC platform. Now, if you're interested in a free copy of this book, please complete the registration in the chat, and 13 copies are remaining and are distributed on a first come, first serve basis. Tanika, will you drop that in the chat again for us so that people will have it? And remember,
yes, I can.
that we will help to amplify your voices in this struggle that we are in. So again, thank you so much for joining us, and have a great evening.
Thank you so much. This was awesome.
Thank
Good night,
you.
everybody.
Thank you.